So good afternoon, everybody. Thank you for this opportunity to speak with you and share my thoughts on rural data challenges in Healthy People 2020. I'd like to acknowledge my colleagues at the National Center for Health Statistics, Southwest Rural Health Research Center, and the Veterans Health Administration. And keep an eye out for talks later today from Dr. Alva Ferdinand and Dr. Timothy Callahan. Healthy People 2020 is a federal initiative that provides a framework for tracking the public health priorities of the Department of Health and Human Services. Healthy People 2020 is a set of about 1,100 measurable objectives with targets that they aim to reach over a 10-year period. These targets are organized within 42 distinct topic areas. One of the overarching goals of Healthy People 2020 is to achieve health equity and eliminate disparities, and this includes rural health disparities. This is an example of an objective on the healthypeople.gov website. The objective is to increase the proportion of persons with medical insurance. The baseline is 83.2%, which is the proportion of persons with medical insurance at the beginning of the Healthy People 2020 tracking period. The target and target setting methods are different for each objective, but for this objective, the target that the Department of Health and Human Services set was 100% or total coverage. All 1,100 or so measurable objectives will have a data source that they use to track the progress of the objective over the decade. For this objective, the data source is the National Health Interview Survey, which does have data for rural areas, but not all data sources are able to provide this level of granularity. If you click on the icon, the Data 2020 icon, you'll be able to access the tracking data for this objective, and I'll show you what will be there if you click on this icon. This slide shows the proportion of persons with medical insurance at the national or total level, and also broken out into metropolitan and non-metropolitan areas. And typically, the metropolitan, non-metropolitan definitions are from the Office of Management and Budget's definition. Like I said, not all Healthy People 2020 data systems are able to provide data for rural areas. Of the over 1,100 objectives, they are supported by over 200 data systems. And of those, about a third of objectives have rural data at the national level, but far fewer of the objectives have data in rural areas by state. In the smallest dark blue circle of data systems that have rural data by state, some examples include the National Vital Statistics System, the Behavioral Risk Factor Surveillance System, and the National Survey on Drug Use and Health, among a few others. So I'd like to share an example from the National Vital Statistics System. I'm going to show you 7 objectives that track mortality in urban and rural areas. These are results from a paper that we published last year. This slide shows age-adjusted death rates for rural and urban areas. The rural death rates are in orange, and the urban death rates are in blue, and the national targets are the gray dotted line going across each chart. So as you can see here, the rural death rates were higher than urban death rates for all 7 objectives that we were looking at. Also, you can see that rural areas had not met any of the national targets, and you would see this as the rural line crossing below the national target line. And finally, I'll point out that rural death rates are typically further away from national targets. And this is because the national targets are based on national death rates. But what happens is that rural areas have to make more progress than urban areas in order to meet the national targets. And I think a lot of what this slide goes along with what Dr. Jan Props was saying in her talk earlier. This slide shows progress towards national targets in rural areas. And what you need to measure progress are two reliable and comparable estimates that you can compare. So for this example, we use data from the change. We looked at the change between 2007 estimates and 2017 estimates and compared them to the national target to get the 4 progress categories that you see at the bottom of the slide. You'll see a green check mark if the target was met or exceeded, a blue plus sign if the rate is improving but had not yet met the national target, a yellow dot if the rate showed little or no detectable change between the 2 time points, and a red minus sign if the rates were getting worse or moving away from the target. And the results I show here are that none of the rates for rural areas had met or exceeded the target as of 2017. Instead, some of the rates were improving towards the target and some were getting worse and moving away from the target. But from a methods perspective, we need 2 reliable and comparable estimates in order to do this type of calculation. And often it's challenging to even have one estimate, reliable estimate for rural areas. So let me summarize some of the rural data challenges here. First, not all Healthy People data systems support estimates for rural areas at the national level, and far fewer support estimates for rural areas at the state level. Measures need to have 2 reliable and comparable estimates in order to measure progress, and it's often challenging to have one reliable estimate for rural areas. The targets are set based on the national rate, and that often means that rural areas have to make more progress to meet the national target than urban areas. The data tool doesn't currently support estimates for rural areas by region. Instead, the data tool provides rural estimates for nationally and by state. At the national level, the data often aren't specific enough, and at the state level, sometimes the data aren't reliable enough. So providing estimates for rural areas by region might be a middle ground. Also, the data tool doesn't currently support aggregating data years in order to improve the reliability of data in rural areas beyond in a way that's different than what's presented for national estimates. And finally, there's no easy way to filter and find these objectives with rural estimates at the national or state levels. The best advice I have is to know the capabilities of the data source and to search for objectives using the data source. Here are other Healthy People related rural health resources. And I'll just highlight Rural Healthy People 2020. The next talk by Dr. Alva Ferdinand is going to be about Rural Healthy People 2030. So some conclusions. In order for Healthy People to meet its overarching goal to reduce health disparities in rural areas, we'll need the data to track and measure progress for rural areas. And to that end, data users could flexibly aggregate data to produce reliable estimates for rural areas. Further, data systems could expand their sample sizes and oversample in order to allow state estimates of Healthy People measures for rural residents. And finally, if you are using your own custom analyses of data, you can use Healthy People as a framework and benchmark for the data that you analyze. Thank you.